Welcome to this episode of the NLN podcast, Nursing Edge Unscripted, the Surface Track.
I'm Rachel Onello.
And I'm Dr. Michelle Moulton. And Rachel, I'm really looking forward to our conversation with our guest today. Do you know why?
Tell me, Michelle.
Because interprofessional education, or IPE, in my opinion, is the GOAT of healthcare education.
Oh, that's a good one. And I'm thinking there may have been people listening like me 3 days ago that didn't know what GOAT stood for. So would you tell us what GOAT stands for? Because I agree with you.
It's not the cute little farm animal that I love and adore. It's greatest of all time.
I would agree. I think IPE can be the greatest of all time in nursing education. So I'm excited to dive into our conversation with our guests, who we're going to introduce in just a second.
This episode is entitled Making Connections, Interprofessional Partnerships to Bridge the Gap, where we will explore a successful model for interprofessional education that helps to bridge the practice academic gap while meeting the healthcare needs of our community members. And to help us today are Doctors Sabra Custer and Omar Lucas. And Dr. Custer is an associate professor at the University of South Carolina. Sabra is also a DNP and family nurse practitioner with clinical expertise in HIV-related care. Dr. Lucas is a clinical pharmacist at the University of South Carolina Immunology Center, Infectious Disease. And this power professional duo works together in an interprofessional infectious disease clinic, providing comprehensive care to individuals with HIV, hepatitis C, and STIs. So welcome, Sabra and Omar. Thank you for joining us.
Good morning.
Thank you. Good morning. Thank you for having us.
Of course.
Sabra and Omar, it's so great to have you here. And I think the best way to kick off our conversation is to invite both of you to share a little bit about the IPE experience that you all have created and are a part of for interprofessional students.
Okay. Well, I'll jump in and give just a real short history of kind of how the program got started, how we developed it and wrote the original grant. Omar's been heavily involved for about the last 3 years or so. I was part of the team when we developed this idea 6 years ago now, 2015, we wrote the grant. We had a lot of involvement from faculty in our 4 professions that are part of the program. So nursing, myself and another nursing faculty, and then faculty from the School of Medicine, College of Social Work, and College of Pharmacy. So we came together with representatives from the clinic and the academic side and submitted this grant through HRSA about 6 years ago to fund this program. And the goal is to bring students from all 4 professions together for a practical experience within the clinical setting. And the clinical context is within this HIV clinic that is heavily Ryan White funded, so a focus on HIV care for patients with no or little health insurance. And so we're teaching them, demonstrating, putting into practice the interprofessional practice principles in this clinical setting, focusing on mainly HIV care. So that's kind of how we got started. We ended up working out for our particular setting and participants that we have a 2-week design. So it's a 2-week intensive experience, total of 6 days over 2 weeks, that all of the students are there together. And we're able to thread the needle and find an agreeable schedule for all 4 professions between 2 to 3 times a semester. So it's kind of connected to that academic semester schedule. So that's what we've roughly maintained since we started the first group in 2016. And Omar, maybe if you want to talk a little bit more about the overview of what we do for the 2 weeks.
Yeah, so in general, what we do is we gather these students from these different professions and have them kind of work together on a project. And that project is such that they have a chance to see from the other perspectives of the other professions working together in a clinic setting where we pretty much take a real life patient. They work that patient up together and they work through the steps of the patient's care for a particular visit. And that branches off, of course, into all these different parts of the profession, whether it be the nursing, the MD, PharmD, social work. And it gives them a chance, I believe, it gives them a chance to work together in not only getting a patient the care that they need, but also in figuring out how we all mesh together. How does this whole thing come together when we're thinking about the person's care?
That's great. Thank you for that overview, Omar. And I really appreciate how, because I know in interprofessional education, some of the biggest challenges are the logistical challenges. And I think it's pretty remarkable that you've been able to pull together this successful interprofessional partnership and collaboration for the purposes of education. And it seems you've overcome some of these logistical challenges. Can you describe some of them, some of those hurdles that you've had to overcome?
I think scheduling is probably one of the biggest ones. And that took a lot of brainstorming and working together and seeing how all 4 programs could adjust. To my understanding, the 3 other disciplines besides nursing, so pharmacy, social work, and medicine, the students who participate in this 2-week IPE experience, they're already at the clinic for a longer, either month-long or semester-long experience. So our social work students, for example, I believe they're at the clinic for a semester-long internship. So that has a lot of advantages because the students are already there. They just kind of step into this program. At times, I've seen some potential challenges because this 2 weeks is so focused on HIV, which is a little bit different than just general infectious diseases, depending on your perspective or your interest. But in general, I think that's worked well. Nursing was a little bit different to figure out how to integrate it into our curriculum and make sure that we have consistent student interest and can fill the spots for the nursing students. We had the advantage there that I often co-teach our final semester, what we call our capstone course in our curriculum here at U of SC. And students do much more independent preceptorships with nurses one-on-one in that final semester. So we approached the faculty for the course, one of whom was me. So I approved it. We were able to negotiate at least some partial credit in their required preceptorship hours for students who apply and participate in this 2-week interprofessional program at the clinic. And we knew that was important because we were worried about getting student interest and participation if it was purely volunteer time on top of their busy last semester. So we really had to look at each program's curriculum and at what semester the students would be participating and how we could fit that into the structure that was already there.
That's pretty much how I would assess it, that there are these 3 professions that are already there for a period of time. And then we added the nursing from the school. And so fortunately, though we're focusing it on HIV, I know that as far as our social work perspective, that's their entire focus, right? Is the HIV/Ryan White component. Because those services aren't necessarily available to the rest of the infectious disease population who's coming there. And then when you have the medicine student, they're kind of getting a global understanding of what happens in the ID outpatient clinic. And knowing that this is going to be by majority have HIV clients, right? So although it's ID clinic, the vast, or I would say the bulk of the patients there are going to have HIV. And so that's probably the bulk of the patients that they'll end up seeing as well. And of course, pharmacy is kind of like in between both worlds, right? So they're going to serve both the HIV component as well as the other infectious diseases and things like that. And so it's kind of set up for them more easily than I would say for the nursing, in that they're already going to be heavily involved in the HIV component of stuff. So.
That's great. Thank you both. And, I really appreciate this idea of making sure that this experience is embedded in the curriculum, because I do understand that, if it's extra or voluntary, it's a lot harder to get participation. But if you can embed it into the curriculum and then really create a meaningful structure around the experience for the students, I can imagine that you could get a lot better participation, engagement, and it would be more reliable and consistent. So I think that's a really good strategy.
I will brag on our nursing students here and take advantage of the little bit of nursing foundation of this podcast that has been so successful with our nursing students. And part of it has been my dual role as one of their faculty who they see a lot through the undergrad program. And then they hear me talk about my clinical practice, that aspect of my career. And so it's really one of the places that myself as a professional track faculty member that I'm really able to merge my clinical practice and my educator role. And I think because of the buy-in I have from students, and because, as you said, this is embedded in our course, we have always filled the available nursing student slots in every rotation of this program. And we always have really good nursing students because we actually have them complete some essays and apply to participate in the program. So we've always had more students interested than we can accept. And I'm just so proud of that. And it makes it strong.
That's great. And that really ties into my next question, which was really around the academic practice real world gap that we often see in healthcare education. And I think what you're talking about is, you as a faculty, you have this dual role of being a teacher and a clinician. And when students see that, I think it adds credibility and it really helps students understand the context of this more real world application of what they're learning, which I think is difficult to do in situations where maybe those two roles aren't as deeply embedded in one person like it is in both of you. So I'd like to talk a little bit more about this practice gap. Can you describe a little bit about how this clinic has helped to address this, differences between how students are prepared at school and how they are really called to function in the clinical setting, in the real world, especially around this IPE context? How do you see these professions coming together to function in the clinic in any profession? So
I would say broadly, you're taking these, as I kind of described earlier, we're taking all these professions and we're saying, okay, we're going to work together on this project, on this patient. And so what happens is, unlike what I've seen anywhere else, where you'll have all of these people really working together, meaning they're side by side. It's not working together as in a handoff necessarily. It's really kind of, we're going to walk together, we're going to think together, we're going to meet with the patient together, right? And so although that's mostly unrealistic, what is realistic is them being able to see the roles of the other profession and see it real time, right? And then understand, okay, these are the challenges or these are the overlaps, right? And this is where I can be more helpful in bridging between, one profession and the other, and understanding how really, when they come together really nicely, it makes a much, much more smooth, I would say, patient care transition or patient care success. And so what doesn't typically happen is that kind of working together. Everybody kind of stays in their own bubble. We learn what we learned in our school. This is what we're taught, and this is what we do. I go in, I do my thing with the patient, and then I'm gone, and then you go and do whatever it is. I don't know what it is with your patient. And so, and a lot of times there's a lot of miscommunication and misunderstanding when you don't have a person physically seeing what you do or hearing, what you have to ask or something like that. And so in this, they're getting a chance to do that. They're getting challenged with some of that, because one of the challenges you'll notice is they'll say, well, I usually ask that when I go in the room. Well, I ask that too. And so how do I do that? You're ready to mess up my role. So if you speak before I speak and you ask this question, how do I do that? Where do I go from here? And so it gives them a chance to really kind of figure that kind of stuff out, like, oh, wow, all right. As well as maybe there's something that they explained, a patient may have explained to one of the other professions that you want to know more about, that you didn't think of or you wouldn't have thought of had someone not been in there to ask that kind of thing. And so it kind of broadens their ability to see all of these different professions coming together, what they do, how it connects to the success of your profession, and how you can contribute to the success of theirs. And so I think that it's really, really awesome in that sense. And I'm using some Donald Trump words, but I think it's really, really great that they get to do that, because it's not something that you typically see. whether it's in the hospital, outpatient care, private practice, it's not something you usually see. And so it's really nice for them to get to do that while they're learning, so that when they walk out into the real world, they have a little bit of perspective.
You all have had such success with this program, and this type of collaborative learning environment doesn't just happen. It's created in an intentional and a deliberate way. And I'm curious if you all could share with us, what are the things that you say or do or experiences you set up intentionally so that when these students come together, they can have those types of conversations like you just described, Omar, of, hey, I usually say that. And, oh, but that screws me up when I go in. How do you create that space for that dialogue to even happen? Because I think that's sometimes where a lot of IPE education falls short. Mm-hmm. What are your thoughts on that?
Yeah, Rachel, you were picking up a note I had scratched down. You know, Omar was mentioning the benefits and kind of that translation, but I think it might be helpful to clarify for people listening or watching just a little bit of like what happens, like what that group project is. So over the 2 weeks, the first week is a little bit more didactic lectures on both HIV topics, transgendered healthcare topics, and then of course IPE topics. So we're sprinkling in, interleaving a lot of didactic stuff. And I believe they spend some time shadowing different professions and shadowing a patient over that first week. The second week, of course, thinking about group dynamics and time for the students to get used to each other, start to trust each other, hopefully. And that usually happens pretty well, I think. So that second week is when we get into more of that project that Omar was mentioning, where the students are actually able to work together. They prep on Monday afternoon. We have a couple patients who are fabulous volunteers and agree frequently to come in for this practice visit. They know they're going to see a group of students. Their patients are, of course, fully informed of what the experience is going to be like. So we give the students time to look up the patient, learn about the patient, and then on a Tuesday morning is our standard time of that second week. All of the students actually conduct a patient visit together, and they are responsible for that visit. One of us, usually myself or Omar, we will facilitate, but we are in the corner. We make it clear to the students and the patient, we are simply there to observe, and we will only step in if things are just going off the rails and we have got to redirect. Students conduct the visit, we go out, they have a huddle, you know, the time that a provider would likely be stepping out, thinking about a plan, developing orders, that kind of thing. So the students have a chance to go back in, recap, share some things with the patient, maybe some follow-up items. And then after that group visit, which usually takes 45 minutes to an hour, we debrief with the students after. I do not have to convince all of the powers of debrief, because really what we're doing with the students in that group visit is an interprofessional simulation, right? So we go and pull them together. We usually have 2 sets of 4 students. We pull them back in and we debrief. And we talk about the clinical challenges that came up. We talk about the interprofessional moments that came up, where they felt comfortable, where they felt like they worked together, were there awkward moments, were there things they do different? I mean, y'all know what debrief is like. And so we spend 45 minutes to an hour debriefing on all of those things from the experience right after they conclude with the patient. And then the students also, to wrap up that experience, they develop a SOAP note, which of course has a basis in like a medicine nursing structure, but they as a group write up a note on that experience, and then they present it on the very last day, that second Friday. So we try to give them that start to finish experience in the ways Omar was describing, that as a group, they are actively coordinating and providing care and summarizing their experience with that patient.
I'll add a little bit. There was once that I had to intervene, but not on the correction or because one of the students fell short. We had a difficult patient one time, and that was difficult and interesting and good at the same time, because they had a chance to really see a patient who was difficult, right? And not so much script, that, you know, a scripted patient where they come in, they know it's going to go great, they're going to be very cooperative and easy. But then you had one who wasn't, right? Who had a bad day. And then this is what we're dealing with, right? And so now it's like, wait, what is going on here? And I intervened only because it was really, the patient was being extremely difficult, beyond reason. And it wasn't fair for the learning experience of the students. And so we're also there to intervene in that way, right? How to help, help the experience of the students actually still happen. And so it was interesting, but again, in that debrief, it was really nice hearing what the students, their experiences were and how they felt about that and what they did with that, right? How did they overcome that? Or was it anything they could overcome? And it was really, really interesting when we spoke in debrief what the different perspectives of the students were having that experience.
That was a really necessary debrief to recover with the students that time. Yeah.
Yes.
That was your group, not mine, but I remember that.
Yes, it was.
I so appreciate you sharing that. I hear a lot of important things in that. One, I hear the importance of when we're pushing our students to the edge of their expertise to grow in their knowledge, skills, and attitudes is to be able to have a safety net there for them, right? So that they can feel safe to take risks in the service of learning, not risks in the service of patient care, but risks in their thinking and learning and trying new things with a safety net there, both for themselves and for the patient. So I appreciated that. And I also appreciated hearing in that story the importance of finding teachable moments and leveraging those opportunities that pop up that you may not have really anticipated, but you were able to make into a really important learning opportunity for them. So thank you for sharing that.
Yeah, and I just wanted to add that, when you think about the learning objectives for an experience like this, the learning objectives might be to have interprofessionals working together. But then when you have this additional challenge that pops up, now you've got a new learning objective that wasn't planned for. And, I think that's always an opportunity, like Rachel said, a teaching moment where, Omar, you were then able to role model, how to handle a difficult situation and still really facilitate the learning, that higher level learning that just kind of came up, but by a different method. That kept the students feeling safe and still engaged. So I think that was a beautiful example. So thank you for sharing that too.
It makes me think about all of the success that you've had. It's not always an easy road to get to where you are now. And so I'm curious to hear some words of wisdom for those listening who may want to improve or buff up their IP experience at their institutions, or maybe create one from scratch. What are some pearls of wisdom that you would share for others that you've learned along the way, or that you wish you knew when you started this?
The thing that sticks out to me most is the investment of both the students. So like Sabra's talking about, you have this people applying to do this. That's really important that you want to be there. And then secondly, the clinic or wherever they're going to do this experience that they're actually welcomed there by whomever is working there in a real live setting, right? Because sometimes it could be a challenge having a student there. You're in a busy day and it's kind of like, I don't really have time to do this or that with you. However, in our setting, fortunately, we don't have that. We don't have that. Everybody is happy and welcoming of the students to shadow them, learn from them, ask them questions, and things like that. And so I think that's critical.
Yeah, our receptive environment. And I think even though some of the administrative, like larger structure of our clinic has changed over the years, I think we still have that heart of being an academic clinic. And so the staff there, from the clinicians, everyone different roles. I think the staff are open to that and flexible, and we just have that mindset that there's always projects going on and there's always students coming through. It's the norm. So definitely agree with that. I think at the beginning, if you're trying to set up something new, I think getting together a creative team of the right people from both the student, the academic sides, and then again, like we said, the clinical side, to work out the logistics on both ends and just think about just all the scheduling and commitment. I think to get the right people together that have the connections with both the professional side and wherever your implementation clinical arena is, that is extremely important, because it just takes so much planning and logistics. We have an administrative staff member within the clinic she's the coordinator and the holder of the schedule and keeping us all in line and confirming every time we have a 2-week rotation. Like, we all answer to Kim, because when it comes down to it, she runs the schedule. So it's a lot of work behind the scenes just to keep things going. So you got to have the right people in place who all do feel it's important and are all, like Omar mentioned, invested. Because our numbers are, there's so many different ways we've learned with some other grantees, because we have periodic meetings at the regional level to kind of update on the different IPE programs. And I've just heard little bits and pieces. Some other programs are able to involve larger number of students, but they don't have the intensity of the experience that we do. So I think there's many different ways to approach it as far as where you want to put the emphasis. If it's number of students getting a little dose of it, or if you have a smaller number, but they really have an involved in-depth experience.
Well, that's great. Thank you, Sabra. And I love this idea of having the key people just that are super invested, that are kind of champions for the effort and understand that IPE is the GOAT of healthcare education. And they can articulate that, they can help to facilitate the engagement with students and keep it going. Because it is challenging. There are a lot of behind the scenes mechanisms and coordination to keep moving. And so everyone does have to be invested. And I really appreciate you sharing that as some of your pearls of wisdom. I was thinking, Rachel, now might be a good time to wrap up with our rapid fire questions.
I agree. I think it's a great time.
So if you were to write a memoir, what would you title the book? Sabra.
How to not take yourself seriously, but still take your profession seriously.
Beautiful, beautiful. I would read that book. Omar.
Geez, that's a tough question. Probably, I wonder how it all happens.
Good. These are some good titles.
They really are. Like, my curiosity is piqued. What is on the top of your reading list right now for fun?
I read a lot of nonfiction. I've really shifted over the past 3-4 years. I used to read more fiction. What I am reading right now is Stacey Abrams' latest book, Our Time Is Now, which has got a lot of history about voting rights, voting laws. I wouldn't say it's fun, but it's really educational. Timely topic for me. So that's what I am reading. I don't know if it counts as fun.
As long as you're enjoying it, I'm with you.
I'm learning.
Beautiful. And Omar, what's on your nightstand?
I'm reading a couple of books because I usually flip between books. One of them is The Vanishing Half. It's by Britt Bennett. And then the second one, strangely enough, is Sun Tzu's Art of War.
Nice. What is your favorite quote?
I don't have a single answer to that one. I don't. I mean, there's some of the classics, be the change you want to see in the world. But I don't have one that comes to mind, because I did look ahead with our little bit of prep we were given that I don't know. I don't have an answer.
That's okay. It's okay not to have a favorite.
Omar, what about you?
So there's a couple, but one that stands out. I don't even know whose it is, so I don't know how to give them credit, but it's someone else's. It's not mine. And it's a smart person knows what to say. A wise person knows whether or not to say it.
Profound. I've heard that too, and I don't know who to attribute to either, but I like that one.
I don't know whose it is, but I stole it.
I love it. It's good. And last one, if you could have dinner with one person, dead or alive, who would it be?
I'd have trouble choosing between two right now. Being in infectious disease and working in HIV care a long time, of course, I knew who Anthony Fauci was before last spring, but just every time I hear him, obviously he's a brilliant scientist, but just the way that he shares information, factual, calm, I have lots of Anthony Fauci memorabilia. I have a bobblehead doll in my office that someone gave me. I'd love to have one-on-one conversation with him. And then I've been reading and listening a lot to Nicole Hannah-Jones in the past year or so. And she is brilliant. I can't always follow her. She's so smart, but I love listening to her and learning about a lot of the topics that she writes on.
That's great. That's fantastic. What about you, Omar?
I would say the person that pops out to me is Isaac Newton.
I like it. I like it. Do you mind sharing a little bit more why?
Because he was weird and brilliant. And so to sit down with someone whose mind is working like that and just learn from them, right? Even though it's going to be challenging and you don't know what the heck they're talking about or where they're going with it, at some point something will connect for you. And it'll be an experience that you'll continue to learn from for many years, right?
Well, I'm really glad I asked Omar, because weird and brilliant is like, it's a perfect combination, and that would be a great conversation. So thank you for sharing. And I think that wraps us up for today.
Thank you so much, Sabra and Omar, for joining us, for taking your time to share your experience, your story, your expertise in IPE. We've enjoyed it. I'm sure our listeners will. And for our listeners, thank you so much for joining us on another episode of the NLN Nursing Edge Unscripted Surface podcast. We hope you join us next time.